So let's talk about emotional exhaustion. Have you ever been on a vacation and you came back from that vacation and you felt even more tired than before you left?
Are we there yet?
Yes.
Really? No! Are we there yet?
No!
Are we there yet?
No, we are not.
Are we there yet?
No!
Or you came back home after a long day and usually your family makes you feel better and unwind, but lately it just feels like it's nerve-wracking. That's emotional exhaustion. Emotional exhaustion is a disconnection from joy, where you feel tired, drained, and down instead. It's important to build awareness of the emotional state you're in because you can shift it. Your emotional state is made up of three things: where your focus is, what language you're using in that moment, and what your body is doing. I'm gonna tell you a story about me and my panic attacks.
Do I look like a guy who panics?
It's nothing to be ashamed of.
Where'd you
know,
go to
it's just
medical school, you stupid bastard? I got a fucking heart attack.
I always knew that I was on the more anxious side of life, but I had been meditating for many years and I was pretty even-keeled. And when I moved to the United States to do my residency, everything was new. There were so many changes. It was a new country, a new hospital, a new culture. And I really didn't understand how much anxiety I was carrying until I started having panic attacks. And it was in a very specific situation. When I was presenting on rounds, my patients, and my program director was our supervisor, my heart would start racing, I would start sweating, I would start mumbling and fumbling, and I wouldn't understand what's going on with me. And I noticed that I would carry that for weeks on end and think about how horribly I did, and just worry about, what if I get kicked out of the program? What if I never do well? And at some point I thought maybe there's something wrong with me. This doesn't sound right. So I got my heart checked, and lo and behold, everything was okay. So reality check. I thought, all right, I have to practice what I preach, and I looked inward and I started noticing, what am I doing that was leading to my panic attacks? And I started to realize 1 week before I was even meant to present, I was playing these horrible movies in my head about how I would fail, how I would mumble and fumble. I'd see myself hunched over. I'd feel this tightness in my chest. And I'd realized that even on the day when I was supposed to present, just driving to work, I would see cars broken down on the street. I would walk into the hospital, it's all gloomy, and everyone looks like they're miserable and they don't want to be there. And what I noticed is not just what you focus on expands in the brain, but also what you focus on becomes all you see, because of areas in the brain like the reticular activating system. Have you ever noticed that when you're looking for a certain brand of car, you start to see it everywhere suddenly? That's because of the reticular activating system. It works in the background to give you more of what you're seeking. This is when I actively started to change my emotional state. When my mind would start to play horrible movies or say horrible things to me, I change my focus by grounding. Grounding anchors the brain in the present moment to help it exit the negative mental vortex. In fact, it's scientifically proven that when the brain is present is when spontaneous joy arises. Think of watching a sunset. If you're thinking about your work meeting or all the stress you have in your life, will you be able to enjoy the sunset? Probably not. But as soon as you start to pay attention to the colors and the sounds and the movements, you start to feel spontaneous joy. How many times have you spent your morning shower planning for your next meeting, instead of enjoying the water on your face, the warmth around you, and the sound of the pitter-patter? I then started to notice what I was saying to myself, and I'll tell you, if someone spoke to me today the way that I spoke to myself back then, I'd probably whack them. Words instantly register in your minds and body. Words create meaning, which create feelings, which create emotional states. Let's do a little experiment. Bring your arm forward like this and swing it all the way back. And just know where you're pointing. Now, bring it forward and repeat after me. The next time I move my arm backwards, all my muscles are gonna work together to make me reach farther than I've ever reached before. I'm gonna be like that elastic lady from The Incredibles. Okay, now swing it back again. And notice, where are you pointing? Maybe you pointed a little bit farther. Now, that's not a scientific experiment, but when I work with groups and we do this experiment, 90% of people point farther. Language is important because it signifies the relationship you have with yourself, and it sends electrical signals in your body. I had a patient who came in one day and she was so distraught because her son's godmother said to her that she enjoys spending time with her son more than she enjoys spending time with her. And this got her into a funk. She was questioning the friendship, she was questioning herself, and she was questioning whether she made the right choice by choosing this person as her son's godmother. And at the time I thought, okay, how can I help this person? So I asked her a question. I told her, if your son was 16 years old and came to you and said to you that their friend said to them that they enjoy spending time with you more than they enjoy spending time with them, what would you say to them? She took a moment and she softened and she said, well, I tell them that they're awesome and they deserve all the friendships in the world, and that maybe they were saying it as a compliment, that they like me and that's why they also like them. I loved that answer. It was great.
Not like a regular mom, I'm a cool mom. Right, Regina?
Please stop talking.
And in my practice, I find that anchoring to a parent's love to their child is such an effective way of forming a relationship with yourself. Because when we think of our children and the people we love and we want to protect, we come from a place of love and kindness, but we don't often direct that energy towards ourselves. When you pay attention and recognize when you're using disempowering language and actively switch to using more empowering language, it becomes who you are. We are our own worst inner critic, and we can learn to be our own best inner coach. Learning to switch your emotional state will affect your body's physiology. In studies done by the HeartMath Institute, evoking a negative emotional state led to a chaotic heart rate variability, whereas evoking a positive emotional state led to a more predictable, more regular heart rate variability, which they called coherence. When the heart rate variability was more chaotic, that signified being in the fight or flight nervous system. But when the heart rate variability was more coherent, that signified being in the rest and recover nervous system. So literally our emotions are sending electrical signals into our bodies. And I have a biofeedback device that I use to help patients switch from chaos to coherence by using breathing techniques and some exercises that we're going to practice in a little bit. You can learn to switch your body's physiology from chaos to coherence in milliseconds by changing your focus, language, and your posture. When I started realizing what I was doing to lead to my panic attacks, I realized that I was rehearsing the worst possible outcome. So I started to do the opposite. I started to rehearse the best possible outcome. Instead of rehearsing failure and doom, I started to rehearse success. And I did that for a week. I would wake up and think about going into work with Superman posture, feeling ecstatically happy, seeing everything as bright and wonderful. As I was walking heroically through the hospital, everybody was smiling, everybody was happy. And as I was moving towards my program director to present my patients, it turned into a Broadway show. Everybody was smiling and dancing, and even the sounds of the hospital became background music. And then I'd present, and I'd do so well that everybody would start cheering and applauding, from the patient in the room to my colleagues, to the nurses, to my program director. A little bit too much, but you know what? At the end of that week, when I actually presented, I did so well, and I never had a panic attack ever again.